My name is Molly Rowland. I am a senior at the University of Missouri studying textile and apparel management. I was diagnosed with Crohn's disease when I was 10 years old.
At first, it was really difficult to get the doctors to listen. My instinct and what I knew is that something was wrong. I knew that this wasn't an ordinary virus.
It was a huge relief to finally have that diagnosis because it gave my family something to focus on. And while it seemed scary getting that new diagnosis, it was actually a huge relief because we knew how to treat it and where to go from there.
We were hoping for something less serious and easier to fix. To know what we were working on and to know what we were fighting against was a big help in moving forward.
It was hard in 5th grade because I was put on a really strong steroid that gave me a lot of major side effects and actually gave myself moon cheeks, which poofy cheeks, and kids actually teased me and called me chipmunk face. And that was really hard. And it was also hard because I was taking so many medications that every morning it was kind of a struggle because I was so young and I didn't know how to take medication yet, that we like to laugh and say that my mom was literally screaming them down my throat.
It was difficult to get the doctors to make appointments and to recognize the value of my opinion as her mother.
When my disease was flaring and I was having symptoms like mouth sores and inflammation, and I was having a lot of diarrhea, and that actually hospitalized me quite a few times.
I think one of the most difficult aspects of this was trying to find the right doctors.
I remember one instance, my male doctor told me that my mouth sores looked like I had just brushed my teeth too hard, which was hysterical in a sarcastic way because they were all over the roof of my mouth. I couldn't eat. They were bleeding. I mean, I was miserable. And so to have my doctor tell me that it was because I was brushing too hard, and even if he was joking, which we kind of assumed he was, it was still really hard to hear that, and it kind of made me lose a little faith in my doctor because he was joking about something that was so serious.
I think there is this notion that the doctor is on a pedestal and really isn't in a place where we can talk to them freely. And maybe you're to ask the doctor questions, maybe you're to speak to the doctor when the doctor speaks to you.
Crohn's disease affects more than just my bowels. It kind of reaches out to all parts of my body and puts in a lot more factors than just if I'm having diarrhea or stomach pains. So that was really hard because they didn't understand that, or they weren't willing to understand that. I think a bad situation that I ran into with the doctor again was when we went to a well-known medical facility in Kansas City, and they did a colonoscopy, and the doctor came in the room, and he didn't have very good bedside manner, and he was very brisk with my mom and I, and wasn't really willing to listen to what we were saying. And after a colonoscopy showed that I didn't have any active disease in my intestines, he kind of just pushed us aside and said, "Oh, there's nothing really going on here, you're fine, it's in your head." And so that was a really hard thing to hear because I was still having so many symptoms and I was still feeling bad, and I was struggling at school to keep my diet under control. And so to have him tell me that there was nothing wrong when I was having symptoms, even when I was continuously telling him, "No, I'm having issues, I'm having issues, I'm having issues," he didn't really care to listen. So I kind of just bounced back and forth to a couple different doctors trying to figure out what was going to work, and they kind of all told me the same thing until me and my mom finally made the decision to drive to a really huge hospital about 8 hours away from our home. And I ended up meeting a really awesome team of doctors, and they were able to go and look beyond what else was happening with my Crohn's, not just the obvious things that you can see with a colonoscopy. And it turns out that they were able to dig deeper into what was going on and look more at my history with my disease, and they were able to get me on some simple medication that made a huge difference for my everyday care.
We're not opposed to hearing "I don't know" from a doctor. What's more uncomfortable is when they say they do know and they give you a quick prescription and not much eye contact and put you out the door. And one of the times when we heard "I don't know," we had a team of doctors, and they really took the time to address Molly's entire picture They weren't just looking for a fire to put out. They were looking at the entire picture and trying to bring her some normalcy to her every day.
Looking back on my experience with doctors and hospitals, I think the one thing that I really learned was that I need to advocate for myself and make sure that the doctors are listening to me and my needs.
My concern is for other people who aren't as strong of people as Molly. They aren't able to advocate for themselves. I'd like for there to be stronger avenues and roads for patients with Crohn's disease to communicate to get what they need.
Because if the doctor knows the whole story, then they'll be able to know how to treat the patients better and really realize that each patient knows their own body and that when they're saying something's wrong, it's important to listen.